Hi everyone, welcome back. This is Dr. Ashok. So today we are going to see about the lecture series on respiratory tract infection. So we are going to study a topic called whooping cough, which is caused by the organism called Bordetella pertussis, and it's one of the most common vaccine preventable infection, especially in the pediatric population. So let us go into the topic now. So here we have a case. So we have a 3-year-old boy who was brought to the pediatric outpatient department with the complaints of cough and post-tussive vomiting since 2 days, and fever and flu-like illness was present for the past 6 days. And on examination there is going to be a cough, and there is going to be a rapid inspiration against closed glottis at the end of the paroxysm. So it is going to end up in a type of cough called whooping cough. And what is going to be the diagnosis? So here it's going to be a 3-year-old boy, and vaccination history is not there. So, and it's about the pediatric OPD with the complaint of cough and the post-tussive vomiting since 2 days. So the patient is in stage 2. So whenever we are going to talk about this particular infection, there is going to be an 3 particular stages. So particular patient is going to have an acute catarrhal phase, where the patient is going to experience fever, cough, and there is going to be something called flu-like illness. After that, the patient will be going for an illness called paroxysm, where there is going to be severe cough associated with the post-tussive vomiting. And after that, the patient will go for an convalescent stage. So here the particular patient had an first stage, that is a catarrhal phase was there, and now the patient is presently having the particular paroxysmal stage. So here it's going to be a case of Bordetella pertussis infection or whooping cough. So here it's going to be a gram-negative coccobacilli infection, and it's going to cause infection in pediatric population who are not vaccinated. So most of the time we are going to vaccinate the particular pediatric age group. In case if there is not going to be an adequate vaccination, again we can have this kind of infection. And I have made this particular PPT in such a way that all the content is going to be in a single slide nutshell, and we are going to read about this particular infection, and it will be useful for theoretical background as well as any preparation for university examination point of view. So let us see about this particular infection. So here there is going to be an introduction. So whenever we are going to study about the particular infection, there has to be one introduction. So here it's going to be a highly fastidious gram-negative coccobacilli, and it's going to be described by a scientist called Bordet and Jengo, and it belongs to the particular group of organism called as non-fermenter, and it comprises of several species, but 3 species are going to be an important human pathogen. So the first species is going to be the Bordetella pertussis. The second species is going to be the Bordetella parapertussis. The third species is going to be the Bordetella bronchiseptica. So these 3 species is going to be an important human pathogen, and the pathogen